Hi there. My name is Gordon Craib. I work in North Battleford, and I collaborated with Dr. Duplessis to develop an enhanced recovery pathway for patients undergoing major colorectal surgery in a regional hospital in Saskatchewan. I'm going to echo what Steve said. You know, these are just reflections on the project, and I sort of approached it from a before and after kind of mindset. So basically, you know, it didn't happen this year, but I mean, when you work in a system over a period of time, your mindset should change because the system isn't constant. So basically, my impression of the work environment and the healthcare infrastructure around me, as well as care delivery, was sort of as follows, and this changed over time. I think it's fair to not expect any system to be perfect, and it would be criticized by some. And to an extent, I didn't think my responsibility was to improve the system, which on my part was a lack of understanding of how a system is created and the time and effort that it takes to create it for everybody's benefit. And maybe I expected the infrastructure just to be available so that I can then start my job, which was providing good patient care. Basically, sort of, I approached it from the perspective of, you know, if it's not perfect, we'll just make the best of it. And if I spoke out or changed or said anything differently, the onus would be on me to change it and make it better. And ultimately, what led me to CQIP was two principles that I find non-negotiable, which are patient empathy and good communication. So after CQIP, just in terms of quality improvement, I understand now more that some of the things on the previous slide are more within my control. And specifically, quality improvement is a science, and not just a science, it's an art. So it's not just about data and collecting data and doing multiple PDSA cycles and refining it, the process over time. It's the thing that I found most beneficial is if you think you're going to change a system on your own, nothing's going to change. So the art, together with the science, is learning how to collaborate with people, drawing people into your project and making them part of the team so that you can achieve the objective. QI is also a language, much the same as ACLS is a language, meaning we don't expect everybody to be the team leader in a resuscitation, but everybody needs to understand the principles of ACLS to be able to move forward. And in the same way, quality improvement is a language. And we have the tools and provision. The province is providing us with tools and the opportunity to learn the language, and then also to contribute to rolling it out provincially over time. And that's my assumption of what the ways of the CQIP cohorts are. Ultimately, I think we are going to contribute to spreading the word so that everybody is speaking the same language over time. And then, yeah, so basically in terms of making changes for improvement, I don't think there are any shortcuts, and communication remains essential. Basically, for me, what's next, or for us, what's next, we've still got a lot to do. The project's not finished. We're going to recap and reflect much the same as perpetuating PDSA cycles. We have 4 cohort members from this group and 2 from the last group, and I'm sure we'll have more for the future in our town. And we will work to continue collaborating with them with our existing quality improvement specialists that are on site. And I don't think we have to look too hard. You guys will see from the project presentations that we'll hear today, opportunity for change is all around us. Yes, finally, I'd just like to thank the Health Quality Council and their staff for being available and always willing to help us. And the CQIP coaches and faculty specifically, I am a firm believer that you learn from observing others, whether it's verbal or non-verbal communication, and I think we had amazing examples to follow. Yeah, my fellow members as well, 2 pharmacists we had with us in the cohort this year, and I think it's great that we involved non-physicians as well. Thank you very much.